Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Uncontrolled inflammation underlies a vast array of diseases, yet the source of the inflammation often remains elusive, forcing us to treat the symptoms rather than the root cause. Could the path to healing begin in our mouths? Mission Evolution Radio TV show is coming to you around the world on the X Zone Broadcast Network, xzbn.net. With us this hour to explore the hidden causes of inflammation is Dr. Sanda Moldovan, Dr. Sona, the author of Heal Up, is a board-certified integrative periodontist and seasoned nutritionalist. Her journey is a testament to her unwavering commitment to the natural oral health and overall well-being. Dr. Sanda shares her vast knowledge with fellow health professionals, teaching them secrets of microbiome testing and how to revolutionize oral health through nutritional therapeutics. She believes that our mouths are the window to our overall health. Dr. Sanda, thank you so much for joining us in Mission Evolution.
Thank you so much for having me, Gwilda.
It's a real pleasure. Would you please let us, so we're all on the same page, would you mind telling us what periodontics is?
A periodontist is someone that deals with the foundation in the mouth. So peri means around and dontist means tooth. So anything that has to do with the foundation around the teeth. So the jawbone, the sinuses, periodontal ligament.
Does it involve the gums as well?
Surrounding structures of the tooth. So that the surrounding structures of the tooth are the gums, the bone, and the periodontal ligament, the jawbone.
Gotcha. So what drew you to that line of work?
I've always wanted to be in the medical field because biology fascinated me ever since I was in school. But I no longer practice as a periodontist. I practice holistic dentistry as a biological periodontist. So I do so much more than just periodontal work currently.
What drew you to that?
Treating the whole, not the whole. Because I know there's a better way to do dentistry out there than just treating individual teeth. We have a lot of people that are suffering today because old dentistry techniques, such as root canal, such as mercury fillings, that made people not feel well. A lot of my patients that come in have chronic fatigue. They have inflammation because of old dental techniques that are still being used, unfortunately, today.
So what are those old techniques?
Root canals, mercury fillings, extracting teeth without properly disinfecting the area and protecting it against bacteria going inside, causing something called cavitations.
And those are?
Cavitations are infections inside the jawbone that cause chronic fatigue and generalized inflammation. So a lot of the patients that come to me that have existing Lyme disease or maybe mold exposure, or maybe just the people that just don't feel well, and their doctor tells them you have inflammation of the body. We see it in your blood test, but we have no idea where it's coming from. Those are the patients that we do a cone beam CT scans on. We look for the areas where teeth were removed and where bone hasn't healed. These show up on CT scan as dark holes inside the jawbone where teeth were removed, whether it's wisdom teeth or whether it is teeth that are more forward than the wisdom teeth. And the recommendation is really to clean out this soup of microbes, detoxify it, send it out to the lab. Every single time I biopsy these sites, they come back as inflammatory lesions with multiple levels of microbes from bacteria, fungi, viruses, and even parasites.
Parasites? What kind of parasites do you find?
A variety of parasites. Some of them you can find my YouTube channel for those of you interested in actually seeing videos of the things that I find inside the cavitation sites. Any parasites are not good for us because really they rob us of our energy.
That's what they do, right?
Yeah,
It's the nature of the beast. So,
exactly.
exactly what is integrative periodontist?
An integrated periodontist like myself, we integrate different modalities and techniques. So I integrate nutrition. I got my certification in nutrition, so I can do a personalized nutrition plan for our patients because nutrition is such an important part of healing. I also integrate sleep medicine in my protocols because sleep is an important part of overall well being. If we don't sleep well, we just can't heal because we're constantly in fight or flight. We also integrate body detoxification. We're in the middle of our detox campaign right now to encourage people to live healthier, just feel better overall. So we integrate all kinds of modalities, laser therapy as well, in order to help with the overall health of the body, not just the mouth.
So, what do you do with the laser?
We do lots of things with the lasers. We have 5 different lasers around our office. We do things like low levels healing. So, for somebody, let's say, has TMJ pain or they're just healing from a surgery, using a laser speeds up healing. I also have cutting lasers that I cut the bone or the tissues, depending on the surgeries that I need to do. We also have lasers that cut teeth. So our dentists don't have to use a drill anymore. They actually use a laser, which is a lot more comfortable. And oftentimes we don't even need to use numbing when we're cutting teeth with a laser. The other laser technique that I use is something called night lace therapy for the back of the throat. It's a procedure that helps with sleep apnea. And sleep apnea, what the problem with it is like it predisposes someone to um, morbidity of 47% who
Ooh.
have sleep apnea. So in our practice, it's something that we recommend a sleep test, especially for those people that snore. And the night lace itself, the laser actually is gentle. It can open up the back of the throat and help people breathe without actually cutting or having to numb up the back of the throat. So it's a pretty comfortable procedure with great results.
Yeah, that's pretty amazing. To the laser can be used for all of that. When you're bringing using the laser to bring healing to the area, is it a function of heat or how does that work?
It's not just heat. Laser is basically invisible. And yes, it does generate heat because we are all energy. And energy from the laser actually affects the cells in different way. It reduces a substance called bradykinin, which has to do with pain. So by lowering the bradykinin in the cell, it lowers the amount of pain when someone's feeling pretty much instantly. And also with the healing, the redness and inflammation, the laser actually increases the ATP inside the cell, which allows it to function better and faster and speed up the healing.
What are silent oral infections? It seems like an oxymoron. Your mouth is where you talk, but it's silent.
Yeah, going back to cavitations, that's one silent oral infection type because cavitations don't hurt. People just don't feel well, but you don't actually feel pain in the side of where a tooth was removed or the wisdom teeth. The other silent infection is gum disease. Uh, Gum disease is an infection, basically. And people unfortunately don't treat it as such. When they look at the gums, oh, they're bleeding, but that's okay. It doesn't bother me. If our hand was bleeding, we wouldn't react the same way. We'd be like, oh my God, my hand's bleeding. Let me do something about it. But for some reason, we look at the mouth. I have a lot of my patients, yeah, my gums are bleeding. They're coming, but they've been like that for a very long time. It's not normal. It's basically an infection caused by, and it's a chronic infection. Sometimes it can be acute where there's actually pus. But even with that, people don't feel pain. So we call it silent.
So when you're working with, say, for instance, the gums or the bleeding gums, have you found that there's also an emotional component, like children that have difficult childhood and that sort of thing?
There's always an emotional component to teeth in general. I mean, people have dreams about teeth falling out, and like we dream about teeth in relationship to our personal issues. There's a very strong relationship, even when it comes to um, well-being and the way we feel about ourselves when it comes to teeth, especially if somebody that no longer has a nice smile that they can showcase.
So, if these infections are silent, how does a person figure out they have one?
By going to an integrative periodontist. That's really the only way. The way our process is in our office, our exams are quite different than your general dentist office. The first thing we do is test for the microbiome, the oral microbiome, when someone's gums are bleeding or they're receding. Because receding gums also means that might not be something right with the oral microbiome. So we do a salivary test in our office to check for the level of infection, if any. Secondly, we do a cone beam CT scan to check for root canals, the health of root canals, whether or not there's jawbone cavitations. And thirdly, we do cavity detection X-rays to see the strength of the teeth, to check for toxic metals such as mercury fillings. So that's all part of a comprehensive integrative dental exam.
I understand with microbiome, there's the good, the bad, and the ugly. Is there some microbiome that belong in our mouth?
Lots of them belong there, and we can't live without them. If we actually had to have a sterile mouth, it wouldn't be a healthy one. Why? Because people who work so hard to, uh, brush too hard, they have problems. They have gum recession or tooth wear. Or if they use too many chemicals, such as strong, even tea tree oil. Tea tree oil should never be used undiluted in the mouth. The same as heavy duty mouthwashes with a lot of alcohol. We see actually ulcerations of the gums because when we don't have a good microbiome, we will see autoimmune issues setting in. So it's super important to take care of the good microbiome, whereas also just as important to test for the pathogenic or disease-causing microbiome.
So, if mouthwashes and tea tree oil and that sort of thing are going to destroy the good, how do we get rid of the bad?
The way we get rid of the bad is doing the salivary diagnosis first to see what kind of bad is there. Not all bacteria is created equal. So we first have in our salivary diagnosis 4 bacteria that we test for we call aggressive periodontal pathogens, and these type of bacteria actually can not only erode the gum and the bone but also stimulate autoimmune conditions as Sjogren's, for example. Like, they can stimulate brain fog, Alzheimer's disease. They can actually stimulate joint pain, affect the unborn baby. We know they travel there. We know they travel to the heart, especially when the gums are bleeding. The other 6 bacteria that we actually look at that we know cause disease are also equally important to find so we can regulate. However, compared to the 4 aggressive type that we look for, they're easier to control. So super important to know what we're fighting. And then my recommendation is always start with good home care. Brush, water
Well,
floss, use a chewable probiotic.
it's time for us to take a station break. Dr. Sonia and I will return very shortly, so don't go away. This is Mission Evolution, www.missionevolution.org. If an infection is silent, how do you know it's there? With us this hour discussing the mysterious silent oral infection is the author of Heal Up, Dr. Sanda Moldovan. Dr. Sanda, Why are silent oral infections often misdiagnosed?
Because we're not looking for them. It is not the norm to actually test the oral microbiome in dentistry yet. There's more and more people realizing the importance of it because of all the studies coming from the medical field about the importance of the gut microbiome. But the mouth is the opening of the GI tract. So we cannot forget about it. As a matter of fact, I work with a lot of integrative physicians in my area that actually pick up gum disease in someone's stool test. Why? Because when the gums bleed or when we're chewing, bacteria from the mouth gets swallowed and it can live very well also inside our intestinal tract. So it is super important to test for things, especially for silent things. Another thing that's not common in dentistry is a cone beam CT scan. In my opinion, anybody that's had root canals or teeth removed should take a cone beam CT scan to really truly assess the health of the oral cavity. We
Where does a
cannot
per-
diagnose from regular traditional dental x-rays.
where does a person go to get one of these?
You can actually look at IAOMT.org for a dentist in your area. Our website, beverlyhillsdentalhealth.com, we have cone beam CT scans in all three of our locations, Encino, Beverly Hills, or Newport Beach, because it's something that we take on any new patient exam that we see.
So you don't have to go to the hospital for it. It should be in house.
A cone beam CT scan is a digital 3D X-ray. The hospitals have more traditional X-rays, which actually have 20 to 50 times more radiation than the dental CT scans. As a matter of fact, sometimes people call me and say, "Can I bring my CT scan for my head?" Unfortunately, not, because we can only read dental scans, not like whole head scans. And typically, whole head scans don't give enough details of the teeth. So we're really only zooming in on teeth and the airway for the sleep apnea testing.
The last time I was at my dentist, he stood me up and he had this thing that went like this. Is that what we're talking about? Instead of just having wing bites.
Yeah, so the things that go around your head, those type of x-rays, are not necessarily 3D. They can be in two dimensions, something called panoramic x-ray. So some dentists still have that. It's okay, but it still only diagnoses 50% of the problems, according to most studies. Cone beam CT scans, we're really able to see inside the jawbones, and we don't have other structures such as the throat superimposed on the two-dimensional panoramics.
So how did this develop? How long has it been around?
CT scans have been around since I went to dental school, which is 20 years ago. So we've had them for quite a while. I want to say maybe about 20% of dentists today have them in their offices, especially dentists who treat sleep apnea. Root canal specialists have cone beam CT scans, and pretty much all the universities that and dental schools, they have cone beam CT scans now.
It seems like we need more of that, right?
We do need more of that, but technology is expensive. So,
Mm-hmm.
cone beam scan ranges from 80 to $150,000. So, not every dentist can afford purchasing such an expensive machine. In our office, we're lucky. I started a group integrative practice. So, we have other doctors that we're all working together, and we can afford to buy more expensive technology.
Understood. So what does having you mentioned bleeding gums? What does it signify?
Bleeding gums signifies that something's not well, something's out of balance. The number one thing that's out of balance is could be, home care habits. Most people brush, but they don't floss or water floss. Or it could signify that the oral microbiome is out of balance. It can also signify that the immune system is out of balance. Leukemia, for example, manifests as bleeding gums. So many things. I always say the mouth is the gateway to our health. If something's out of balance, we got to look deeper than just gums.
So it could be in the bone, it could be any number of places within the mouth.
Yeah, either the bacteria in the mouth is not balanced enough. It could be an immune system issue, a disease, a systemic disease, or maybe it's just a habit. We need to brush and water floss more often.
What causes these imbalances? It would seem like we should naturally stay in balance in our biome in the mouth.
Yeah, the number two, like number one thing is really our daily habits. And the second thing is really diet. If we have a diet that's processed and full of sugar, we're going to see an imbalance in the mouth. We're going to see more cavities and more gum inflammation. Sometimes what we notice, our patients, a lot of them work with integrative physicians, they change their diet and the gum disease reduces significantly as well as the cavities reduce significantly. So
So
it's important.
the sugar issue, we always think of, oh, you're chewing on a gum and there's sugar and you're packing it into your teeth. But
Mhm.
is it also a systemic issue that then impacts the teeth with the sugar?
Yeah, the systemic issue is inflammation with sugar. As we eat more sugar, we get more inflammation, and it increases our risks of, getting diabetes, obviously, if it persists for a period of years. So we cannot treat, unfortunately, just oral diseases without addressing, okay, what are you eating? How are you sleeping? Because the mouth is connected to the body. We can't just deal with cavities without talking about the diet because the cavities will come back.
Oh, even once you've gotten rid of them, they're coming back?
Absolutely. Yeah. So our cavity reversal program, we actually work with people to first do a salivary testing to understand the microbiome when it comes to cavities. Then we actually walk them through a program that to strengthen the teeth prior to even starting to drill in the teeth because teeth are alive, they're organs. And the worst time to drill in a tooth is when somebody has rampant decay everywhere or cavities. We need to strengthen the teeth first through ozone therapy, through mineralizing the teeth and the body via calcium and phosphate, as well as vitamin D3. We know that's a lot of studies have been linked with lower vitamin D in the body with higher risks of cavities and gum disease. So it's super important to look at a program as a whole and the body as a whole, because otherwise, if we're just drilling and filling, the patient will be back in a year with those fillings falling out and cavities underneath them.
Well, there you get your light bill paid anyway, right?
That's true, but we really stand for, changing someone's life and their smile, not just, drilling and filling.
So from what we've been talking about so far, it sounds like the typical American lifestyle is death on teeth.
Yeah, so luckily things are changing, especially where I live here in LA. We have so many healthier choices, but it's not the true everywhere. Especially when it comes to carbohydrates, which processed foods, a lot of them are carbohydrates. The white bread, which is sticky, it sticks in between the teeth. Cookies and crackers that stick on the teeth, or maybe even like sometimes dried fruit. People think like, oh, dried fruit is okay, but no, it actually sticks to the teeth and it has its own natural sugars. Um, Chocolate, on the other hand, is not that bad because it doesn't stick to the teeth. So if you want to have chocolate, it's not a bad thing to do. It's got a lot of magnesium and things that makes us feel good. It's much better than actually having some sticky carbohydrate that is going to sit there and cause cavities.
Well, in our normal daily lifestyle, we also have a lot of stress. We aren't in natural sunlight a lot. Does that impact it as well?
Stress definitely impacts the oral cavity because people who are stressed, they clench and grind more. And in the last few years, with the changes that we're seeing in the world, we definitely have seen an increase in people who are clenching and grinding. And with clenching and grinding comes tooth wear and joint wear, the TMJ joint. And people start developing joint pain. So we definitely always recommend some supplementation to help with the relaxation in the evening and also um, really help with rebuilding the jaw joint, like collagen, for example, is such an important thing to help to rebuild the joints. And of course, having a well-fitting night guard that's comfortable is also important in protecting the teeth from breaking and wearing down.
This might be off left field, but let's give it a try. In some practices, they believe that each tooth has a meridian that's functional in the whole electromagnetic system of the body. Do you know anything about that? And would you please share?
Yes, we have a meridian tooth chart in every single office here. And I do see quite a big correlation with it. We see a correlation with women with breast cancer, for example. We know there's a study that was done with a few hundred women, and over 90% of them had root canal teeth in the meridian of the premolars, which is basically the breast meridian.
Interesting.
Oftentimes, I try to relate if people have a root canal that basically is leaky and now it's showing cavitations around it, and it's related to digestion, let's say, as a lower front first molar. Typically, people will tell me, yeah, my digestion is not good. And how do I know this? Because I myself had a root canal treated tooth in the meridian of digestion. I never associated the two until I actually had it removed and my digestion improved.
So, if the tooth has the meridian, what happens when we remove the tooth?
When we remove the tooth and we clean out the site, the meridian is functioning better.
Oh, so the meridian doesn't rely on the tooth
No,
particularly.
the reason we remove teeth, Gilda, is because there's a problem with the tooth. We don't just remove teeth. So, for example, if somebody has a root canal treated tooth, and Jerry Tennant actually was the one who really correlated this very well. He's an ophthalmologist who teaches now healing is voltage. Basically, it changes the voltage in the area. So, unfortunately, those are also called silent infections because a root canal treated tooth that has leaking bacteria in it doesn't cause pain necessarily. Some people tell me, oh, yeah, I feel a little something, but most people don't feel anything except for the fact that they're tired. When we remove a tooth that's had chronic infection for so long and we clean up the area, that bone is now healthy and energy can flow through it again. But when we have this stagnation through a root canal treated tooth that's got leakage in the bone, that stagnation prevents energetic flow through that meridian.
So, how about different types of metal? I know that, of course, the amalgam fillings are pretty poisonous, but do different types of metal in there, like gold or whatever, interfere with the meridians in the mouth?
They do. There's something called galvanic current that happens when two metals of different type in a moist environment exist. So, for example, in the mouth, we can have, let's say, titanium implants. So, and mercury fillings. So, in another place, that is definitely very strong galvanism between those two. And galvanic current is very well documented in our research. We know it exists. People have measured it. And I have people with symptoms. They say, you know what? I have this like tightness. I get headaches late in the day. And when I look at them, they have top and bottom mercury fillings that are basically up against each other.
Oh my
That
goodness.
is a galvanic current. So when you have a battery in your mouth,
Well, I'm sorry. We're gonna have to leave a cliffhanger here. Battery in your mouth on the other side of this station break.
yeah.
Dr. Sanda and I will be right back to continue our discussion. So stay right there. This is Mission Evolution, www.missionevolution.org. Do you have bugs in your mouth? This is Mission Evolution, missionevolution.org. With us discussing the importance of oral microbiome is Dr. Sanda Moldovan. Her website, drsandamoldovan.com. Let's go back to the good old bugs in the mouth. What impact does oral microbiome have on your whole system?
The oral microbiome has a big impact on the whole system, and I think it's been underestimated for many years. We know that there are studies, and the first real studies that came out was actually in the 80s with Dr. Offenbacher, who showed a strong correlation with low birth weight babies. So, highly recommend women that are planning on getting pregnant, make sure you see your dentist to check to make sure that you don't have any gum disease. Then we had studies coming out showing the correlation between cardiovascular disease, meaning heart attacks and strokes, that are 2 to 3 times higher when someone has gum disease. And after that, we had a variety of studies linking periodontal disease, let's say, to prostate cancer, linking them to inflammation in the joint. We know one particular oral bacteria that causes gum disease can travel to the joints and cause arthritis. Also, there have been studies linking Alzheimer's disease with Porphyromonas gingivalis, which is one of the stealth bacteria that causes gum disease. So, super important to check oral health, especially when somebody is having other chronic issues.
So, what common oral hygiene practices upset the microbiome?
What upsets the microbiome is definitely not taking care of it. So, ignoring it. That's number one. So, how do we ignore the microbiome? By leaving the bacteria in between the teeth to have a party. Most people brush, but they don't floss. And I say, a string floss, it is difficult to use. The technique itself is difficult. You have to wrap around the floss around each tooth like a C, go up and down. And some people just don't have the dexterity for that. So my recommendation is start using a water flosser. It makes a big difference. A water flosser oftentimes can actually shoot water all the way in between the teeth to clean that bacteria. If bacteria stays in a place for 3 months, it actually can change morphology. It can become flesh eating, meaning is you're going to start to see bleeding. That's why you go to the dentist, say, oh, you're not flossing, gums are inflamed, and the cleanings tend to be very painful at that point. So super important to not ignore your microbiome. So my recommendation would be to brush, use a water flosser, and then pop in a chewable probiotic. That's going to help to nourish the microbiome. So we don't want to ignore it, and we want to nourish it. We also don't want to throw at it a bunch of chemicals that are antiseptic, such as, for example, I'm not a big fan of alcoholic mouthwashes that have a very low pH, because that's going to kill the good microbiome, but the microbiome that actually causes disease will still persist, and they typically tend to be more aggressive and they grow back faster.
So, what is the oral microbiome reset technique?
The oral microbiome reset technique is a technique that we do here at Beverly Hills Dental Health and Wellness. And it's a technique that's non surgical. I'm a true believer that we can reset the oral microbiome to a healthy place without the use of chemicals, without the use of surgery. As a matter of fact, I think the worst time to do surgery as a periodontist or gum surgery, which I'm sure some people listening have had, is when the gums are bleeding. So in our practice, we do a salivary diagnosis test, then we wipe off the entire biofilm, but not just from around the teeth, from the gums, from the tongue, from underneath the tongue, from the cheeks, and the back of the throat by using airflow therapy, which basically it's almost like a gentle pressure washing technique that we use to clean the microbiome from the entire mouth, not just from around the teeth.
So, you're cleaning everything out. Then, do you reintroduce who needs to be there?
You got it. That's exactly right. We actually, through the three step technique, brush, water floss, and a chewable probiotic, we're introducing friendly bacteria to help to reset the population with a normal balance. Because oftentimes, if we're just getting the deep cleaning around the teeth, what ends up growing back first is the bad bugs. So that's why typically the technique on itself doesn't work, and people need to have deep cleanings every 2 years.
They're miserable once in a while, much less every 2 years, yeah. So,
Exactly.
you mentioned the chewable probiotics. Where can people get those?
Um, Chewable probiotics, we have them at orasana.com. Full disclosure, it's a company that actually I started because of the need of having chewable probiotics that are good tasting. I used to use this other company and they were so chalky that my patients just didn't want to take. So I said, okay, we need good tasting probiotics. And these are vegan certified. So for people, they're grown on a non lactose medium for people that have sensitivity to milk products.
Yeah, that's always an issue, isn't it? And a lot of us do
Yes,
have that
absolutely.
sensitivity. So let's go back a little bit to implants. I mean, that's the latest greatest, right? It just makes me cringe to think about it. But
Mhm.
what kind of options do we have? We have root canals. If you pull a tooth and you want to replace the tooth, but if those the metal they use in the implants is damaging to us, what other options do we have?
Great question. A lot of people still don't know that besides the titanium implants that we have, we also have ceramic implants. So ceramic implants are non-metal implants and they've been around for over 35 years. Of course, a lot of the research always starts in Europe when it comes to dental implants, but now we have FDA approved companies that are doing implants in United States. And we had, thanks to Europeans, a lot of studies that are 15 years long to show the longevity of ceramic dental implants. So nowadays, most of my patients want ceramic dental implants because of the metals and the ion release that we see with the titanium implants, and especially people that have autoimmune issues. And I lecture quite a bit in the dental community and about the danger of titanium implants and autoimmunity. We have some studies to show that a metal such as titanium, nickel, mercury can actually exacerbate the symptoms of autoimmune disease.
On another topic, but totally related,
Yeah.
when a client comes to you, patient comes to you, and they have, gosh forbid, all sorts of old amalgam in their mouth. Now, of course, we want to get rid of it, but is there a certain way that you have to go about getting rid of it to minimize the damage to the person?
Um, yeah, I mean, we want to make sure that we minimize them inhaling mercury. Super important. So we use a technique developed by IAOMT, which is the International Association of Oral Medicine and Toxicology. Because what happens, and actually on my podcast, the Holistic Dentistry Show, I had Dr. Kennedy, who was a big advocate of mercury-free dentistry, explain his research how, when you drill into a mercury filling, you get so much mercury vapor released that it doesn't smell like anything. We don't see it. We just inhale it. And it's about 2,000 times the level of the EPA allows in the atmosphere. So many dentists, unfortunately, are toxic. They get neurological issues, suicidal thoughts.
Mhm.
I mean, the dental profession is like the number one in suicide. And I think part of the reason is the neurotoxin we're inhaling every day.
Yeah, it makes you wonder. I mean, I've had people say, well, they're just suicidal because nobody likes the dentist, but there's something else going on here.
Yeah,
Yeah,
exactly.
yeah.
So
So, how can something in your mouth impact your whole body like this? What's the mechanism there?
the mouth is connected to the rest of the body in a couple different ways. Number one, the blood vessels connect the gums to the heart. It's all a connection. So easy for bacteria from the mouth when the gums bleed to catch a ride on the blood vessels and end up lodging in the heart valves. Another way it's connected is through the GI tract. So we actually swallow things from around the mouth. Digestion actually begins in the mouth. So super important to have a full set of teeth so you can chew your food well to make it into a paste, and then we swallow it. And if we have disease causing bacteria in the mouth, then we definitely just get swallowed and it can affect and cause inflammation farther down in the intestinal tract.
So does excuse me, you hear the importance of chewing your food well. Is that because of the good microbiome in there that it needs to start digesting in the mouth, or what's going on there?
It's actually the secretory IgA. So we actually get the enzymes that are used for food digestion in the mouth. So as we're chewing, and also saliva, it's hugely important. So as we're chewing, saliva gets produced, and especially our salivary rate increases. So it allows the breakdown of food.
So, a lot of people that just grab a shake here and there and don't sit down to a sit down meal and take time to chew are missing that step.
They're missing that step exactly, and some of the shakes can be actually including enzymes, and that's a good thing. But the problem is we do need to chew. We do need to put that pressure on the teeth, like we were talking about meridians earlier. That stimulation of chewing is important. Also, it's important, for the entire structure and swallowing, or the structure of our body, the muscles and mastication to stay fit by incorporating enough fiber in our diet. So if somebody cannot chew, other things are going to start to suffer, like the structures of the face, the posture. People can get more headaches when they don't have a bite that's collapsed. So it's all important.
So, if children first they grow
Mhm.
teeth, then they lose their teeth, then they grow their teeth back. Why can't we continue to grow teeth back? Is there any studies going that we might engage that little activity?
Yeah, definitely those studies going on right now trying to grow teeth. Is it going to happen in our lifetime? Maybe. The problem is a tooth is an organ. It's got its own blood supply. It's got nerve supply. It's got a bone structure in there. So the difficulty they're having now is like, yeah, we can go to structure, but can we grow the front tooth to look like a front tooth? We haven't learned that messaging yet. Or are we going to grow a molar, just a blob of a tooth? Can something like that even be created? We're not there yet. We don't understand exactly what is the messaging to create a front tooth versus a molar. I think we found a way actually to grow fibroblasts to actually create gingiva in the lab, which I think is pretty incredible. So when I do the gum grafting, we can actually scrape somebody's cells, put them in a petri dish, have it grow the tissue, and then substitute it where we need to.
Oh
So
my! Because I
yeah, so
remember the day when you got a graft, it was from somebody else or something else.
exactly. And that's still the case today,
Oh
actually. We
my!
use donor tissue, we use own tissue as well, and we have some synthetics that are out there right now. But we're coming a long way with the technology. So, and hopefully in the future we can grow teeth that look like teeth.
So what about, and we're about out of time in this segment, but what about when you have problems in the bone? What about bone grafting? When you're having trouble there.
Yeah, that's an interesting topic. Like today in my practice, I try to use the patient's own bone
Hmm.
as much as possible. Why? Because there's such a variety of bone grafts out there. Uh, Cow bone, there's horse bone, there's donor bone. The problem is this is not a vascular, not cells that are alive. So when we actually put it in a site, it depends on the patient's healing as well, whether or not it's going to integrate. And there's some studies out there that some of them never integrate, especially synthetic grafts. I've actually had a couple patients that it exacerbated or created an autoimmune condition
Oh
shortly
dear.
thereafter. They got
Well,
a bone graft.
it is time to take another station break. Please stay with us as Dr. Sona and I continue to explore the silent killer in your mouth. This is Mission Evolution, missionevolution.org. Is the jawbone connected to the hip bone? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Sanda Moldovan. Her website, drsondamoldovan.com. Dr. Sonda, tell us about bone infections in the jaw. We touched on it a little bit, but it seems like it's kind of a big deal.
Um, yeah, the mouth is the number one place where we introduce bacteria inside the bone, like no through extractions. So, for example, people go get their teeth taken out, and the area, maybe during the healing, while they're eating, bacteria from the mouth enters the body. If we have surgery anywhere else in the body, they usually make sure that bone is covered and it's stitched fully closed. It is not so in the mouth. Oftentimes, like especially since years ago, dentists would take out a tooth and then they would give you a gauze and tell you to bite on it. However, that bone is exposed. Sometimes it fills in with a blood clot where the tooth was removed, but a lot of times it doesn't. And if those of you that have ever had a dried socket, you know how painful that is. What does that mean? The bone is exposed now and it died. So during that process, when the bone or the dry socket has formed, bacteria has lodged into the jawbone. And unfortunately, the gums just close over the top, closing the bacteria inside. And then it starts to create a home there. And people start to not feel well. Some people actually feel a sensation in the area where this has happened, but some people just say, you know what, I've never felt well. Ever since I had my wisdom teeth removed, I felt really like lethargic. I don't want to go out anymore so much because I don't have the energy. So that's when we look at the jawbone infection potential. And the only way to really diagnose is via cone beam scan.
Oh, again, the cam, this
Yeah, the
yeah,
one that wraps around the head.
gotcha. So, if you get infection in the bone in your jaw,
Mhm.
how does that affect your whole system in that you just don't feel well? All the things depression. I mean, it seems like they don't seem connected. How does that all link up?
Yeah, great question. When we have chronic infection or like bacteria inside our body, our immune system sometimes sees it, sometimes it doesn't. And this bacteria basically multiplies, or it could be bacteria, parasites, fungus, whatever. It's a soup usually. This escapes from the site of the area of necrotic bone and it just goes throughout our body, it circulates. Sometimes it lodges in other places, sometimes it doesn't. And the immune system sees the bacteria that's actually circulating in the blood, but it doesn't necessarily see the focal point of it, where we have necrotic bone in the jaw. So that's why, even though, they might go to the doctor and say, oh, yeah, looks like you have an infection somewhere. Let me give you an antibiotic. It'll take care of it temporarily. But until we actually treat the jawbone infection, patients actually will continue to have recurrent problems. So when the immune system is on alert from having circulating bacteria in the bloodstream from a cavitation, it kind of puts a burden on it. It cannot focus on other things, and then people can have like a hyperimmune system that also causes other problems. It can actually cause also leaky gut and have inflammatory like rashes and brain fog, things of that nature.
So, how does all this stress on the immune system, does that then relate back to your autoimmune diseases?
Yeah, absolutely. So we have quite a few patients in our practice that I've treated that had a flare up in their autoimmune disease. Their doctors send them to me to evaluate their oral health, and once we got the oral health under control, they were able to stabilize the autoimmune condition.
Is there evidence that the autoimmune condition can start in the mouth versus be made worse by what's going on in the mouth?
I have not seen any studies to actually pinpoint, yes, your autoimmune disease started in the mouth. We haven't seen that. However, we know of studies of correlation, meaning if you have titanium implants, if you have mercury fillings, we see an exacerbation of your autoimmune condition.
And does the same thing go like arthritis?
And same thing with arthritis. And arthritis is mostly connected to gum disease. We know that certain bacteria can actually lodge, in the joints of those patients, creating painful joints.
So I've had someone say to me, every time I eat sugar, my arthritis just goes nuts. So it's not the sugar to the arthritis, it's the sugar to the immune system to the arthritis.
Or the sugar to the bacteria and to the arthritis, because, bugs love sugar just as much as we do. So, when they're happy on sugar, they're going to multiply more.
And
Mhm.
we have so much hidden sugar in our diets, don't we?
It's so true. I mean, there's hidden sugar even in the things that we don't think are sugary. For example, breads, or even sometimes, like sauces. For example, barbecue sauce, which is such a staple in the American diet. But yes, definitely too much sugar overall.
So, are we really looking at when you're talking about the dietary approach to dealing with all of this? Are we looking at really just having to become a health food nut and prepare all our own foods, or how serious is this?
I think it's really learning to read the label.
There's
Uh,
that.
I still buy a lot of foods, but a lot of them are going to say now, and you will see on the front of the thing, zero sugar added, or, so we have to really read the label and look on the back and see how much sugar is it in this product per serving. I think this is one important thing that like all of us have to start to look at, because the next thing you know, if you're not paying attention, you easily ingested over 100 grams of sugar in a day.
What about sugar addiction? That seems to be kind of a big thing in our society today.
It is a big problem, sugar addiction, and people sometimes are addicted even to natural sugars, like
Mhm.
fruit juices, for example. I actually talk to patients that think drinking fruit juice is good for you, and in fact, when you look, even like a fruit juice, it can have more sugar than a can of Coca-Cola.
Oof.
So we have to be very careful. It doesn't mean that if it's natural sugar, it's not bad for you. So it's definitely something to eliminate as well. If you want to have fruits, have the whole fruit. Why? Because there's fiber in the fruit. Like, choose an orange versus orange juice. The fiber in the orange will help to regulate how fast that sugar goes inside the bloodstream.
So, Dr. Sanda, is that time in the show when I get to ask you, what's your mission?
My mission is to educate as many people as possible the importance of oral health to overall health, to not ignore oral health. They're doing everything right for the body, but not taking care of their mouth. And it's such an integral part of wellness.
How much availability? I mean, I know out there in California, you're in pretty good shape, but the more rural places, how much availability is there to this information and to the treatments that are superior, if you will?
Um, if you some sources of information, and there's a lot of things I think that people can do at home. So on orasana.com, I post quite a bit of resources, not only on a healthy diet, but also on oral health. And let's say we have a healthy gums program. If you're going to have bleeding gums, there's certain procedure that you can use at home in order to minimize that. So I really empower people to take their oral health into their own hand, and you can start anytime. Just because you haven't used a water flosser in the last 50 years, it doesn't mean that starting today is not going to make a huge impact in your oral health. It will. So, hugely important to just start little habits will make a big difference.
What are the signs to watch for that you may have oral infections that have spread to other parts of the body?
If, for example, you see that you're not sleeping well, or you see that your gums are bleeding, or maybe you're getting like inflamed lymph nodes right underneath the jaw, you can actually feel these if you feel like lumps inside the jaw. And I also recommend to do an oral self exam. And on my YouTube channel, you can actually find some guidelines for this. But basically, actually look in the mirror, look at your teeth, look on the sides. Do you see any brown spots? Look at the gums. Do they look puffy? Stick out your tongue. Is it coated with white, or is it has a nice pink color? Look underneath your tongue. Do you see anything that looks abnormal? Do you have any growths or bumps or lumps? Also important to prevent any oral cancer, but also just for overall health.
So, what does white on the tongue or red slices in the tongue? What do those indicate?
Great question. Coated white tongue means, again, an imbalance in the oral microbiome. And typically, it means there's too much candida or yeast overgrowth in the mouth. And when people eat a lot of sugar, they will get more candida. And how will you know? Basically, if somebody feels bloated and they stick out their tongue and the tongue is white, most likely they have candida all throughout their GI tract. Um, and brushing of the tongue or scraping the tongue is a good habit to get into. And basically, this can be done even with the back of a teaspoon. You don't necessarily have to go and buy a tongue scraper.
So if you decide, whoops, we look like we got candida, how do you treat it?
If you look like you have candida, number one is diet. Do you eat a lot of sugar? Start to do some substitutions. What can you substitute sugar with? Monk fruit, erythritol, and xylitol, and also stevia, of course, for those of you that don't mind the stevia aftertaste. Um, Super important. And then also start scraping the tongue, and you can go to your dentist to evaluate the rest of the mouth. Also, if you're getting like these red things at the corners of the lip, that's also a sign that you're going to have a candida overgrowth in the mouth. Popping in a chewable probiotic is actually going to help to reduce the level of candida in the mouth as well.
So, how can one prevent silent oral infections from starting out in the first place?
In order to prevent silent oral infections, number one, to prevent the gum disease, brush, water floss, use a chewable probiotic twice a day, every day. And to prevent infections inside the jaw bones is really to follow up with a biological dentist, with an integrative dentist, with your oral health. If you have root canals in the mouth, make sure you get a cone beam CT scan to see what the health of those root canals are, because a lot of the silent infections, not only in the mouth but in the body, can come from that. And really ask the right questions to your dentist. What does my root canal look like? Do I have any cavities? Really pay attention. Do that self-oral exam that I mentioned in order to stay on top of your oral health.
So, in closing, what's your best advice for our people?
My best advice is to know that the mouth is a gateway to your health. So take care of it in the best possible way. Don't ignore it. If you see bleeding gums, take care of it as soon as possible. If you see a brown spot in your tooth, take care of it by going to your dentist as soon as possible, because the longer you let a problem go on, the harder it is to fix.
Well, unfortunately, we are out of time. Dr. Sanda, thank you so much for coming on the show and sharing your wisdom.
My pleasure.
Our guest this hour has been Dr. Sanda Moldovan, the author of Heal Up, a double board certified integrative periodontist and seasoned nutritionalist. To find out more about Dr. Sonda, where you can find her books and all she has to offer, visit her website, drsondamoldovan.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, visit www.missionevolution.org. But please be sure to join us right here next time as this mission continues, bringing information, resources, and support to our rapidly evolving world.